So for me personally, I'd always wanted to become a nurse, but then I kind of didn't have the qualifications when I left school. So I tried to go back later on when I had my children, and then I went back to get my qualifications.
I worked in a health service in different jobs, and I'd done home care before, and I just really enjoyed the patient side of it. I liked learning about the stories about the patients.
Like, this is a second career for me, and I was an accountant previously, and I started to realise that I was more interested in the people that I was dealing with rather than the actual numbers that I was dealing with.
Being part of the network, and I'm proud to say being part of the network being created and established, has been a lifeline and a vital platform throughout our degree.
It's something that I was brought into as a second year student, and that's my only regret, is that I didn't start first year. But yeah, it's been really, really positive experience.
Just having that support and backup, really. If you've had any issues, you've been able to speak to members of the network and of UNISON themselves. To work through it amongst yourselves in confidence, and then if you need to take things higher, at least you know you've got that support behind you as well.
Yes, the pandemic was a challenge none of us expected that we would be facing, but out of it there's been many silver linings. I did undertake 2 COVID Red placements during the crisis when we were asked to support the NHS, and those were really, really challenging times where we were exposed to death on an unprecedented level that you just never think you would see in your career, let alone as a student.
My first placement, which was deemed as a paid placement, was within clinical research, and it was basically looking at the trajectory of the disease and working for the vaccine, AstraZeneca. My second one was in a COVID ward, which was completely opposite side of the spectrum, where we were looking after people that were end of life and didn't have their families there. So both were real privileges, but completely opposite ends of the spectrum. I think it's so important to become part of a trade union, especially within our profession, especially when we don't feel that we've got that support from the government.
I think UNISON have been the constant one who've actually asked about you and been a bit more personal rather than just standoffish.
UNISON has been the most engaging, the most involved.
Just come along, get involved, because you never know, you might learn something new, and it's a chance to connect with other people.
Well, the students on the network have been really brilliant throughout the whole pandemic. We know that the NHS has had a really tough time. The students that have been trying to maintain their studies and support the NHS have worked really, really hard, and they've had a lot of challenges. So students that you've spoken to have worked with us, they've helped us understand the challenges, they've spoken to their colleagues, and they've gone out there and worked with them to learn what problems they've got. And they've helped us take those problems right to the very senior people in the NHS, people at the NMC and Health Education England, to help them understand exactly what students are going through.